Good morning again. This is Dr. Alan Huff with Precision Spinal Care. Today is December 31st, 2012. We're going to punch out one more video on plantar fasciitis. Okay, so plantar fasciitis, the muscle bellies underneath the foot, the plantar aspect of the bottom of the foot, the muscle between it, and that membrane between the muscle bellies, that's called the fascia. That's upset between the muscle bellies and the bottom of the foot, plantar fasciitis. Foot pain, that's what we're really talking about. Conventional treatment, most people get physical therapy. They take ice and rub it. They're advised to get off their feet and rest. Some people take NSAIDs, non-steroidal anti-inflammatories. Some people get cortisone shots. The real question is why does it hurt and how do we get rid of it and what's the fastest way? Partly because of my belief system, I think that when the body's out of alignment, when it's not in a state of correction, that we work one side more than the other, which is why one foot generally hurts first and more than the other foot. We're just placing too much weight on it. But when you're on your feet all day and you can't get off them because you have to keep your job or you've got kids or you're running around and you've got 30 other things to do, what you're doing is you're overusing the calf. So below the kneecap, between the heel, that's your calf, your gastrocs and your soleus is down there, and they pull on that tendon that connects your calf to the bottom of your foot. And that intersection is called the Achilles tendon. That Achilles tendon moves that talar and calcaneal bone up, and that overstresses the bottom of the foot for the plantar. So that's kind of my view of what happens is we're overusing our calves, putting extra stress on it if we're on it a lot, putting even more stress on it if we're not in correction and balance, and we're going to create strain and sprain in those muscle bellies on the bottom of the foot, causing you the pain. So instead of treating the pain, we should correct the body back into balance. And what I teach a lot of my patients to do is take a percussive massager or a handheld vibrator or even manual massage and massage the lower part of the calf. So that's midpoint between your knee and your heel on the back side of your leg. Massage from there all the way down to the heel. And you'll find it really tender when you get in there and you're kneading it and you're moving it and you're massaging it. You'll find that really tender. That needs to be done for 2 minutes, 2 to 3 times a day to get that tissue to change over. And as you get that tissue to relax, get the strain and sprain, get the overuse out of the calf, you'll reduce the sprain and strain on the bottom of the foot. I've seen dozens and dozens of plantar cases get better only because we helped the calf or the gastrocs and soleus for people who like the longer words. But when we get that reduced and we get that healing and we get that tissue changed over, and we get that massaged out of there, those acids that build up, the lactic and malic acid and some other things that aren't changing over with the tissue, then you'll watch the bottom of the foot start to heal. So you need to massage or percussive massager or handheld massager or manual manipulate between the middle of the back of the leg, so the center point of the calf down to the heel. And you just need to work all that tissue out and massage that out. And you'll find it's pretty tender, but the more you keep up with it, the better it'll get. Don't forget, it's better to do what you're told than to investigate the truth. It's easier to believe what we've been taught. So investigate the truth, try it out, let me know. Again, this is Dr. Alan Huff with Precision Spinal Care.